This is Dr. James, and if you like these videos, please like them, follow them, share them, help them get out to as many people as possible. So today we're going to talk about failure to thrive. And what this is each time your baby is seen for a well visit, we plot their head circumference, their length, and their weight. And we do this on a curve. It's specific for girls and boys. And we follow that growth trajectory. Where you are on the curve doesn't really matter. It's as normal for you to be at the 5th percentile as the 95th percentile. And of course, most people huddle right around the 50th percentile. But what we look for is we look for a pattern of growth. We want you to grow along the curve. Or if we see you start to go up, we want to look and see that happen in everything. We don't want just your head to be growing extremely fast, because that could indicate that there was something like hydrocephalus going on. We don't want your head to quit growing, because that could mean that your brain wasn't growing the way it's supposed to. But in failure to thrive, nothing seems to be growing well. The first thing that usually is affected is weight. Your weight starts to fall off the curve and the curve starts to go down. The next thing is height. Their length starts to go down. And then finally, head starts to not grow as fast as possible. This is where we get the most concern, because head growth equals brain growth. At this point, we start to do what we call a failure to thrive workup. In failure to thrive, basically, we can narrow it down to either we have a baby that's not eating enough. They're not putting enough volume in them. So we have a problem eating, or a problem producing in the case of breast milk. The second one is a caloric problem, that there's just not enough calories going in. And then the third one is there's a baby problem, and that baby problem could be a problem of absorption. This would be like a milk protein allergy, or problems with like cystic fibrosis. It could also be a problem with burning too many calories. This could happen with hyperthyroidism. And then we could have some sort of infection. So part of the infectious workup that we would do with things like HIV, the torch infections like toxoplasmosis, rubella, cytomegalovirus, the herpes virus, and we look into all these things. Then of course there's genetic issues that can cause babies to not grow the way they're supposed to. So it's a very complex workup that requires many tests to try and find out. And it's a if-then statement. A lot of times we'll try something and see if that makes the baby grow. And if that doesn't, then we've ruled that out, and then we try the next thing. And in a way, it's kind of frustrating, because it kind of seems like your baby's being turned into a human experiment. And in a way, they are, because each individual baby is different. And we have to find out what your baby has going on so that we can fix it. So it's stressful. It's stressful for you. It's stressful for your pediatrician. And of course, the most stressful person it's on is the baby, because they're the ones that are not growing the way they're supposed to. So time is of the essence. When your head stops growing the way it's supposed to, we want to find these things, and we want to find them very quickly. So that is failure to thrive and how we work it up.